Hi everyone, welcome back to AceTheAMC. Today we have a exam question from our partners AceTheExam. It's a great question bank for all your AMC style questions. They have questions that have been written by practicing physicians who have sat the AMC, so they're very, very reliable. Today we have a question on adrenal crisis, so let's get into it. We have a guy who's come to the emergency department with a diagnosis of Addison's disease, and he is suffering from an adrenal crisis. He's been treated for a chest infection, which is important. His blood pressure, he's hypotensive, he's tachycardic, and he's hypoxic. Which of the following statements are correct? So first of all, before we get into this, we need to know what Addison's disease is. This is primary adrenal insufficiency, and it's autoimmune destruction of the adrenal cortex. Remember, and then we need to understand what does our cortex produce. So we have three layers of our cortex. We have the zona glomerulosa, the zona fasciculata, and the zona reticularis. So the top layer, the glomerulosa, produces aldosterone, or a mineralocorticoid. It's influenced by angiotensin II. We have the fasciculata, which produces cortisol, influenced by ACTH, which is important here. And then we have the reticularis, which produces androgens, is also influenced by CRH and ACTH. So we also have to understand about adrenal crisis, and what happens is that we have a severe lack of our mineralocorticoids and our glucocorticoids, which causes us to become hypertensive. And it's a really, really big issue, especially for someone coming in acutely like this into the emergency department. So the first thing we need to know is, how do we treat it? We give steroids, and we give it without any delay. And we also want to aggressively fluid resuscitate this patient. So let's go through the answers and we'll talk a little bit more about it. The first one, we want to urgently refer to the endocrinologist for guidance and then start therapy. This is obviously incorrect. I just mentioned that we want to start treatment straight away. We don't want to delay anything. So even that little time that you go to call the endocrinologist and come back, that's still too late. This patient could die. So that's incorrect. Serum cortisol and ACTH levels could be measured prior to starting treatment. This is also incorrect. Remember, if we're going to measure the serum cortisol and ACTH, it's not really going to show us much. We already know this person has Addison's disease. We don't really need to measure that. And we don't need to really assess the adrenal function, because we've been given in the question, we know it's an adrenal crisis. So we need to treat as soon as possible. So that's incorrect. Intravenous fludrocortisone is preferable in this patient, as it does not interfere with cortisol assays in the ACTH stimulation test. So remember the ACTH stimulation test is what we use is the gold standard to diagnose Addison's disease. So when you're thinking about diagnosing primary adrenal insufficiency compared to secondary, we want to first of all check the 8 a.m. Around 8 a.m. we want to check the cortisol levels. If they're low, we then want to go on to an ACTH stimulation test. So we give someone synthetic ACTH. Remember, that's produced by our anterior pituitary. That is going to then affect our adrenal cortex. And we want to see a rise, or a significant rise, in cortisol levels. So you give ACTH and then you check it every 30 minutes. And you want to see a significant rise. If you don't, you can then diagnose primary adrenal insufficiency, as compared to secondary, which is a pituitary problem. So we would have low ACTH. Remembering the difference between primary and secondary, a big one that comes up in exam questions is hyperpigmentation. So in primary, you see hyperpigmentation because you have lots of ACTH, and this is produced from something called POMC. POMC is a precursor to ACTH. It is also a precursor to MSH, which is melanocyte stimulating hormone. And if we have more ACTH, it's backed up to POMC, and it is shunted down the path to MSH. So we get more MSH and we get more melanocytes, and we start to get hyperpigmentation in the palmar creases, the extensor surfaces, so our elbows and knees, and generally the patient has more of a dark-skinned appearance. Intravenous fludrocortisone would also not be correct in this instance, and I'll explain that a little further as we go through. So intravenous vasopressors should be started for blood pressure management. This is incorrect because patients in an adrenal crisis respond really well to intravenous saline. So as I said, we want to aggressively fluid resuscitate this patient, and they respond really well to that. So that's incorrect. And then finally, intravenous hydrocortisone should be given immediately. This is obviously the correct answer. So as we said before, we really want to give steroids stat, and we want to give them intravenously because they're quicker as opposed to orally. Hydrocortisone over fludrocortisone because hydrocortisone is a glucocorticoid and we're looking to replace cortisol. The reason that this guy is having an adrenal crisis or his blood pressure is really low is because he has a chest infection. So he has some type of stress on his body and his adrenal glands are unable to produce enough cortisol. Remember, cortisol is really important for maintaining tone in our vessels. So when we have lots of cortisol, we can increase the amount of alpha-1 adrenergic receptors. This allows our catecholamines, so noradrenaline and adrenaline, to act on these blood vessels, and it allows us to vasoconstrict or maintain tone. Without that, we vasodilate and we can't maintain perfusion. It also helps with glucose regulation and other things like that. So we want to replace the cortisol is the primary goal here. And with hydrocortisone being a glucocorticoid, that is the mainstay of treatment. Along with that, we also want to aggressively fluid resuscitate the patient. So we'll mark that and we can see that that's correct. And we have a great little explanation there as well. So if you guys wanted to pause that and go through, it's really, really important. But thank you very much for staying tuned. If you wanted any other questions to go through, please let us know. Otherwise, we'll see you in the next one.